Hi, my name is Galina Ginning, and I would like to to explain in a very simple way about congenital aniridia for some parents, because a lot of questions coming, especially after the last aniridia conference, about what this in a very basic points and how to live with this congenital disorder. Number one, let me talk today about aniridia as a PAX6 associated syndrome. So 90% of cases with congenital aniridia, they are coming because gene, we call it PAX6, has some kind of mutations, like some kind of changes. And this gene not only includes in developing of eyes, but also includes in developing of endocrinological system and neurological system. So this is why we call this disease PAX6 syndrome. Another important thing, what we have to understand, that in some cases, aniridia can be part of bigger disorder. We call it Vagar spectrum. And I will not talk about Vagar spectrum now. You can easily go on a website called vagar.org, and they are very clearly explaining what this disease is and how to live with this disease. But I'm talking about this in case of understanding that it's very, very important to do in a very early stage genetic test for your child with congenital aniridia. Another important thing, why we are talking about gene, just we have to understand, because aniridia, it's genetic disease, then the cure for the disease will be only gene therapy. So now a lot of different projects going on this field, and we are waiting that in one day the solution will be found for the disease. The cure will be available, but at this stage, until it's not available, we have to think about how we can keep the health of patients with aniridia in the best condition we can. So to do this in a proper way, we have to, number one, be very, very careful with eye pressure, because aniridic eye has different structure from normal eye. So sometimes the liquid what is circulating inside the eye can be stuck, and then we can have high eye pressure. This high eye pressure can damage optic nerve, and of course the signal what we are receiving from our eyes and what's supposed to go through optic nerve in our brain, this signal will not reach our brain actually if this optic nerve will be damaged. So it's very serious to regularly measure eye pressure. In this case, company, they are Finnish guys, Finnish company, they developed eye care tonometer. Eye care tonometer can be for professionals and can be also for home users. The latest model is Eye Care Home 2. We are using, my daughter, she's using Eye Care 1, the very early model, but it's still working. She's 14 years old now, and this is very easy to measure eye pressure without going doctor, and to be really updated with your eye pressure. So this is very important. So we are caring about eye pressure, about our optic nerve, and if there is any kind of changes, the first thing what we have to do, it's like connecting to our doctor. We're using some kind of eye drops what can put this eye pressure down. We are trying to avoid any kind of surgeries. Why? Because aniridic eye, also like being very specific, has not enough limbal stem cells. Ophthalmologists call it limbal stem cells deficit. So this is why all the patients with aniridia, they have this problem, like during their lives, cornea slowly destroying. And this process called keratopathy. to do kind of prophylactic to stop this process, we can simply use, by recommendation of doctors in these days, and especially the first one who was talking about this is Dr. Barbara Kessman, the head of German Aniridia Center. Since birth, it's important to use special eye drops, special eye gels, or special eye creams, what includes dexpanthenol, or these days we're also talking about heparin. There is a lot of names. It can be hiloparinkamod, hilazarkamod, optinol. It can be bepanthen Augen drops, corneal gel with dexpanthenol. For the night, if it's already like first stage of keratopathy, it can be bepanthen Augen cream. It can be Vita Vision cream. It can be Parin Pos cream. So using all these things, we are protecting cornea, which is also very, very important to keep this eye in the best condition we can. And also understanding that we have problem with this limbal stem cells, we have to avoid, as we can, any kind of surgeries. All the patients with aniridia affected by PAX6 gene or associated with PAX6 gene, they are low vision patients. And also we have to understand that low vision itself, not because these patients don't have iris or don't have part of iris, but because they have macular hypoplasia. Like macula not really well developed in an aniridic eye, and macula at the center part of retina, and this is why these patients lose vision. So if you will put artificial iris or whatever, some kind of a lens, it will not make your vision perfectly fine. Absolutely not. It just can protect from photophobia, but we also have to understand that knowing that cornea is our weak part of the eye, we can protect eyes with glasses, photochromic glasses, sunglasses, and this is the easiest and the most proper way to protect eye from photophobia. Understanding that cornea is our weak part. So even using contact lenses, we can destroy cornea. With some heavy surgeries, we can destroy cornea. So we are trying to avoid eye without surgeries. But of course, if you have high eye pressure and then you use one type of drops, and then doctor recommend you another type of drops and another type of drops, yeah, we're trying, we're changing, and then the eye pressure is still high, then specific doctor who is working with an aniridic eye, they know what surgeries is available for congenital aniridia, what surgeries can be good by the way of don't destroy the cornea, and then you go for this doctor and you do this type of surgery with what can minimize the trauma for the cornea. This also we have to understand, and this is the same with cataract. So doctors who are specifically working with aniridic patients, they understand in what stage and how to do this cataract surgery, in what cataract we have to do the surgery and what cataract we can keep for a while. So all this very, very important. And again, we are not forgetting that this is syndrome. We have to be careful with measuring sugar because it can be diabetes, metabolism problem, we keep this in mind, sleeping problems, high sounds can be problems in crowded places. So it's important to be in a contact with endocrinologist and to be in a contact with neurologist. About different kind of rehabilitation for being patient with low vision, there is a lot of information in internet. But in this video, I think what I said, it's the most basic things, what we have to understand, having child with congenital aniridia or having congenital aniridia ourselves. Thank you.